The morphologic hallmark of acute inflammatory reactions are the vascular changes, edema, and the recruitment of more inflammatory cells to combat the inflammatory reaction. There are some vascular changes as well as there are some cellular processes. But the microscopic patterns of the inflammation are more particularly that depends on the severity of the reaction, specific cause of the inflammation, and the site and the tissue that is involved by this inflammatory process. There is diversity in the outcome of the acute inflammation, and there are many factors in the host as well as the nature of the inflammatory response. They determine the outcome. So if the injury that is the cause of this inflammation is infarction, bacterial infection, or toxins or trauma, there will be acute sort of inflammation that is marked by vascular changes, recruitment of the neutrophil in the presence of many mediators. So this acute inflammation that has developed now can have three major outcomes. One is the complete resolution. The inflammatory process will be cleared. There will be injurious stimulus cleared, clearance of the mediators and the cells that have invaded this area. There will be replacement of the injured tissue or cell, and the site or tissue attains normal function. So this is also termed as healing with repair. There is complete resolution and return to normal function. Or this injury, if it undergoes injury and inflammation, if undergoes into liquefactive necrosis, it may result in pus formation that is seen as an abscess, a localized collection of pus in a cavity that is lined by a pyogenic membrane is called an abscess. So there will be invasion by neutrophil that is present in acute inflammation. Some cells are dead, and there will be presence of necrotic debris and necrotic neutrophils also that are characteristic of these pus formation. This abscesses may undergo healing or directly, or there will be acute inflammation that will go towards the fibrosis or healing. When there is a large area affected and or there is a lot of fibrin that has gone outside the vascular compartment and there is organization of this fibrin outside, and it is not cleared by the macrophages and other phagocytes. So this tissue will be invaded by fibroblast, and fibrosis will occur in this area. So this is termed as healing with fibrosis. Healing with regeneration, liquefactive necrosis, or healing with fibrosis are three usual outcomes of the acute inflammation. If the injurious stimulus is not cleared away, or there is viral infection or overstimulation of the immune system, as happens in autoimmune disease, this acute inflammation may progress into chronic inflammation that is marked by angiogenesis, that is new vessel formation, mononuclear cell infiltrate, and fibrosis. And this chronic inflammation may lead to fibrosis or healing with repair. This flowchart is summarizing the events. Acute inflammation may undergo resolution, complete resolution, that is the usual outcome, or if there is excessive exudate, there will be formation of suppurate, and this is suppuration and abscess formation. Abscess formation may directly lead to scar, development or formation of a scar. When there is excessive necrosis of the tissue, it will be be leading towards the repair and organization of this site, and there will be fibrosis. That is major hallmark of this condition. Extensive is tissue involved damage. The primary inflammatory or acute inflammatory damage is more. There is a large area affected, so there will be fibrosis. Or if the acute inflammation is persistent, it will lead towards the chronic inflammation. So repair and organization can also lead to the resolution, but here this is the over here when there is excessive necrosis, there will be healing by repair, and usually there will be healing by regeneration.